If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. As you know, this program was created to assist you in understanding medical issues. In this way, you can take charge of your own health. Now, it's more important than ever to become an informed patient, and we're here to bring you timely health discussions. For those who are new to the show, there are two ways to get your questions in. First, you can call our live phone line at 718-499-6101. And second, and I've been getting a lot of these lately, are emails. You can email us at asktthedoctor@netny.net. And we're going to bring those questions into tonight's discussion. So anything you have, email us. Now, for this episode, we have Dr. Catherine Economos, gynecologic oncologist, and we'll tell you what that is, and attending a New York Methodist hospital. Dr. Placido Morano, a rheumatologist at the New York Methodist Hospital. And Dr. Emil Bakash, a geriatric medicine attending a New York Methodist Hospital, and also president of the medical staff. Welcome to all of you. And we're going to get to meet the doctors in a little while, but let's get to the news. It's been a busy news week, health-wise. Now, the first story is your TV may be killing you. Now, I'm not talking about Ask the Doctor here. This is a possibility. But a study came out today, the first of its kind, that showed that people who watched 2 to 4 hours of TV a day had a 150% increased chance of getting a heart attack. Ooh. And this is a tremendous increase. It has to do with, there seems to be some association with inflammation of the blood vessels. And Dr. Bakash actually brought in a heart and blood vessel that he's going to show us a little bit later. And this predisposes to heart attacks. So the problem is, you really shouldn't, you got to be active after work. And they found these people came home after a long day of work, they're tired, and they lie down. I think the key is if you get a treadmill and put it in front of the TV, you could then have your cake and eat it, so to speak. So just remember, lying down 2 to 4 hours and watching the TV, you got a big problem. Okay. Now, where did that stent go? Anybody out in the audience have stents? I see a couple out there, a couple of hands. These stents, these metal meshes that go in after they do angioplasty, which is when you balloon open a tight blood vessel that's narrow and not giving enough blood to the area of the heart. So you open that up and you put in this metal mesh and it keeps it open. The only thing is these are not without problems. And 15 to 20% of people getting that can actually have heart attacks because of clotting that can form on the actual little metal mesh. They've now invented a stent that dissolves, and it's been made available in Europe yesterday. And Europe's going to be using it for about a year, and then it should be coming to the United States. It's a big breakthrough. It seems to have less risk of stroke, and it goes away. So if down the road you need to get some kind of treatment, you won't have a metal stent to deal with. So something to ask your doctors about. It's down the road, though, probably about a year in the United States. Now, what about Prozac? I mean, everybody knows we take Prozac for depression and things. Amazing study came out that showed that people who take Prozac, people who've had a stroke that have taken Prozac, have 2 more quality years on average than other people who are not taking Prozac. And many doctors are now putting their patients who've had a special type of stroke we call ischemic stroke, which is the most common type of stroke where you're not getting enough oxygen to a part of the brain. Putting the person on Prozac prolongs the life, and more importantly, not only does it prolong life, but makes the quality of life better. So 2 years added. You got to ask your doctor. Anybody who's had strokes out there, ask your doctor about Prozac. Now, shingles, one of the most painful diseases known to man. Anybody have shingles? No. I see a couple of people out there have. This is very painful. It comes after chickenpox, many years later. And the most common group to get it are those over 60. Today, the CDC recommended that people over the age of 60 get a vaccination, which can lower the risk by about 70% of getting this debilitating disease. Now, there are some downsides. For one, most insurance companies don't pay for it. It's up to $300 a shot. And Dr. Bakash was pointing out that many of the doctors do not have the equipment or the facility to properly administer the dose. So it's something to ask your doctor about, but the CDC has now made it official that people over the age of 60 should be getting this vaccination. Now, I want to talk about it was a fun event, and I hope it was informative. We had a Meet the Doctors, live Ask the Doctor, the first of its kind. We went to the Virgin Mary Church on January 9th, and I'd like to thank Father Antoine Rizk for his help in hosting it. He really got the crowd. We had about 200 people when we started, only about 3 left by the end of the show. But it was a boring show. I mean, there's no telling about that. But I want to show a little clip from the show. Just look at some of the excitement that you missed here. So here's a clip from our Sunday Meet the Doctor show. What's your name, please?
George Hayata,
And where you
from
from?
Brooklyn North,
Which part?
Bay Ridge.
So do you agree? I'm not sure what the answer was.
was.
What was the answer?
Yes, let's do it.
We used to be neighbors.
Okay. But with the restaurant she gave?
No.
We visit the restaurant sometimes.
Okay. So what can we do for you?
Well, my question is, I've been diabetic for over 6 years, and I'm still on medication. I take high blood pressure medication, Benicar, 10 milligram every day. And besides, I take Lipitor, 10 gram every day, but my pulse is always between 90 and 110, most of the time.
Diabetic, and he wants to know if he should be on beta blocker, and if he keeps his numbers well, like the glucose and the hemoglobin test, will that mean that he won't get heart disease? It's good questions.
Yes,
I see. Okay. So, in addition to that, you have to make sure that your blood pressure is less than 130/80, and your sugars are controlled. Your cholesterol is, your bad cholesterol is less than 100, right? This is what we do for people for diabetes. Now, usually is, first of all, we'll have to find out what's causing you.
And see the event in its entirety, you can watch our special web episode beginning Friday on netny.net/askthedoctor. Also, a special thanks to Antonio Gaeta. He's from Tonio's Restaurant, that great Italian place on 7th Avenue, who generously gave us fine Italian dishes on Sunday. I didn't get any food, but I got the dishes with great, which, by the way, I didn't get the sample because it was going fast. But thanks for the dishes, Antonio. We really appreciate that. Loyal member of the family, Ask the Doctor family. I want to stop at this second because Dr. Bakesh worships at this church, and I can't thank you enough for how hospitable everybody was, and it was fun. I hope, tell us a little bit about that church. It's kind of unique.
It's a great little church. It's on 8th Avenue between 2nd and 3rd Street. It's the jewel of Park Slope. It's a very pretty church. It's a Melkite church, which is an Eastern Rite Catholic church, and the pastor is Father Antoine Rizik, a very young, enthusiastic pastor, and it's a beautiful place, and we love to have other worshipers come, and I'm sure he'd welcome everybody. It was great that you hosted it there. It was a very interesting and fun event. And
it was a great cross. You had young, you had old. It was a great cross section of people, and just something nice. It was special to be out on the road, and we hope to do that again. And I thank you.
Oh yeah.
And we had prizes, by the way. People got these Ask the Doctor mugs, which you see here, and we had trivia. It was very nice. Somebody from Maspeth came down to see the show, so it was very nice. Show. So Monsignor, have you ever been to that church? No, Monsignor hasn't been there, but it's something we got to go there another time.
Sure, we should do it again.
The quiz, okay, now get ready. Here's what you've been waiting for. The sales of what product dramatically increased during the Reagan administration? The sales of what product dramatically increased during the Reagan administration? Okay, think about that. You get it, give us a call, and very, 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 very sought after plaque that you'll win. Okay, let's meet our doctors. Dr. Kathy Economos, who I just found graduated from Midwood High School.
That's right.
Midwood High School. And you were around, though. Your father had you moving.
Yes, after being in the parochial school for 9 years straight, I ended up going to 3 different high schools because we moved to Europe, came back. So it was nice. I got to meet a lot of different people during high school, many more than the 9 years that I was in the same school.
And I was listening to that gynecologic oncologist. Just explain in English what that means.
That's one of the 3 main subspecialties in gynecology. After doing a residency, you can specialize in either high-risk obstetrics or reproductive medicine or gynecologic cancer. So it takes extra training after a residency, 3 to 4 years to complete that training and then subspecialize and treat only cancer patients.
Is it depressing for you at times?
It is, but the many times that I do see successes is what balances out the psychology on my part of being able to practice. So it's good to try and help people in whatever problem they're encountering.
And there really aren't that many specialists, and Kathy is one of a few, and it's nice to have you here in Brooklyn at New York Methodist, so people don't have to run into the city to do it. They can come here and get a parking ticket here.
There's 2 of us at Methodist, so yeah.
Much less the parking ticket in front of Methodist than it is in the city.
It's true.
Yeah, Dr. Placido Morano, who's no stranger to this stage over here, has been on many times, backed by popular demand. Tell us a little bit about what's new in rheumatology.
Well, let me just tell you, I had similar events in my life. We moved to Europe, back to Europe, and then we moved back to the States. I went to parochial school as well, but I never met you.
There's a little known fact.
But it was similar. It was similar.
Which parochial school?
Severine. I went to Severine High School.
Oh.
You went to which school?
I went to Bishop Ford High School.
We competed. We competed.
Bishop Ford, and that's in Bay Ridge.
Yeah,
And
I'm
Bishop
David.
Ford is right
here.
near the
Right here.
studio.
It's right near the studio.
Yeah, I don't like to tell them exactly where we are.
Yeah.
You never know who's out there. Okay, so what? Tell us a little bit of something new in rheumatology.
Rheumatology is getting older and older. As the country
People
is
are living longer.
People are living longer, aging, more and more osteoarthritis, wear and tear, and we haven't figured out how to prevent this, and they're working on it to sort of keep cartilage in a state where it doesn't break down.
So we're going to talk about your aches, your pains, what you can do about it, some of your inherited diseases. So we look forward to that. And thanks again for coming down.
you.
Dr. Emil Bakash, who I sat through a meeting, he did a beautiful job today. As president of the medical staff, he has to get the different types of people together, administration, and I thought it was a brilliant job.
Thank you very much.
Tell us a little bit, does that psychology that you use there help out in the practice there?
Well, it's an honor to represent over 1,300 doctors at New York Methodist Hospital. We have a great bunch of doctors. It's a great hospital, and it's growing. It's better than ever. It's made remarkable changes over the last 10 years, and it's really doing well. We do very sophisticated procedures there now, including open heart surgery, valve replacements, neurosurgery. You know, it's unbelievable, putting stents in carotid arteries and stents in aortic aneurysms and all these other prosthetic things that you would only normally see in university hospitals that are done at New York Methodist Hospital. So it's really quite advanced, and it's gone quite beyond being just a community hospital. And the physical plant is exceptional because they have such great facilities now. It's like completely renovated. It's a shadow of what it had been.
Thanks. And we look forward to questions about those who are over 60, over 65. What would be the category?
Over 65, 60, 65 is
Some of
fine.
the problems that the baby boomers who are now turning that age are encountering, and what we have to look forward to.
Sure.
Thanks a lot. So we're going to go right to our busy phones. I see they're really lit up tonight, to be expected. Let's go to Clariana. Hi, Clariana.
Hi, Doctor.
Hi, Clariana. Come a little closer to the phone.
Yes, good evening, and thanks for taking my call.
Yeah, somebody's giving you a hard time about the calls?
Yes, long time ago. I'm trying to enter. This is my first time.
I recognize your voice, but I need you to just talk up a little bit so we can hear in the audience.
Okay.
What's the question?
You told me to turn off the TV.
Okay, turn it off.
Okay, I turn it off.
Okay.
Okay.
So tell us a little bit, where are you calling us from?
From East Flatbush.
East Flatbush, okay. And what can we do for you?
Well, I would like to know, please, if AICD implantation from the leak of the battery can cause acute leukemia.
Okay, I need help on that. Did you hear that?
Something about something.
AICD and...
Is this a device when your heart needs to be...
Exactly, I have it.
Okay, let's ask a little bit about... Let's see, we'll talk a little bit about the device and where its usefulness can be. Okay?
Sure. Well, an AICD device is a device that is designed to treat a condition called ventricular fibrillation, which is a fatal arrhythmia. And so there are leads placed on the heart, which are placed there through the veins. And the device is like a little computer with a hard drive, and it has software in it, which is implanted under the skin, similar to how a pacemaker is, usually in the left upper chest or the right upper chest. And what it does is it senses when there is a group of skip beats that occur in sequence all together. And when it senses that, it records it, and then it gives a jolt. The device is generally checked at intervals by the cardiologist, who can actually query the device with a remote control and actually can get a printout and readjust and change the settings on it, the sensitivity. If the device fires abnormally, it can be desensitized so that it'll fire under less stimulus. But it's a great device, saves a lot of lives. There are specific indications for its implantation, you know, such as congestive heart failure, where the heart muscle isn't pumping very well, and if the ejection fraction is very low, or the amount of blood that is pumped is very low.
Thanks so much. We've got a call because we've got to move on.
Sure.
But I think that is a life-saving device, and we're glad that it's, you know, you have it. If you need it, then it can be life-saving. I see Geraldine is waiting patiently. Geraldine?
Hello?
Hi, Geraldine. How are you?
Fine.
Where are you calling us from?
I'm calling from Bensonhurst.
Bensonhurst. What do you like out there?
What do I like out here?
As far as food. What keeps you in Bensonhurst?
There's really nothing, to tell you the truth. And
Oh, my God.
I don't
I'm
really
from
go out to
Bensonhurst.
eat too much. I'm physically disabled, and I have to take...
What about that Gino's? I don't know if it's Bensonhurst. I really like that place. What about Gino's?
I don't even know Gino's. I'm only living in this area 5 years. I originally came from Borough Park.
Okay. All right, so you get out to explore eventually, right?
Well, you know, I go around with a walker, so it's a little bit hard.
All right, we got the snow coming tomorrow.
Oh, please. I was supposed to go for eye surgery. I can't even go for it now.
No, you don't want to go out tomorrow. What would you give the city on the cleanup in your neighborhood, A, B, C, or D?
I would give it an F.
Oh.
All right, it's a family show. Please, let's.
I would give it a D, actually.
Okay.
I mean, I had to call up the Assemblyman's office the last snow that we had to get the street plowed.
Yeah, no, it's terrible. We had a hard time all area Park Slope as well. Now, there's a rumor that you have the answer to the question.
I believe I do.
Let's repeat the question first. What product sales increased dramatically during Reagan administration?
Jelly beans.
Jelly beans. No. That was a good guess. You almost had me there. I thought you had it. But jelly beans was a great guess. Who was the jelly? Wasn't it Jimmy Carter?
No, Reagan was a jelly
Reagan
bean.
was the jelly bean.
It was jelly beans.
But that's a great guess.
That's why she said it, yeah.
Great
Oh,
guess.
and I thought I had it the minute I saw it come up on the screen.
So next time, you think a little bit more. But that's a great guess, and thanks for calling us.
Thank you. Have a
We're
good
going to take a little
evening.
break. Let's take a little break. We've been busy here.
Outfits, yeah.
What? You had something?
I thought it was chimp outfits.
Oh, chimp outfits. Okay, we're going to come back with more of the wit of Dr. And we're going to be taking more of your questions. So remember, our topics are gynecologic oncology, rheumatology, geriatric medicine. Now, the number to call is 718-499-6101. And you can also email us your questions at askthedoctor@netny.net. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where our topics are gynecology, rheumatology, and geriatric medicine. And actually gynecologic oncology, which is cancers that women may get. Now let's get to more of the questions. Who are we going to go to? Let's go to Marie on line 3. Hi, Marie.
Oh, hello.
Hi, Marie. Where are you calling from?
Brighton Beach.
You sound a little down tonight.
Oh, no, I'm not down. I'm fine. How are you?
Well, okay. We're a little afraid of the snowstorm?
No, not really.
How'd they do in Brighton Beach, the snow? Was that removed properly?
No, not really.
Yeah, we've got the short end of the stick here in the outer borough, so to speak.
In the meantime, if our maid didn't lay off all these sanitation workers, maybe the streets would have been plowed much sooner.
Interesting. What about Tatiana? You ever eat there?
No, I don't eat Russian food.
So what do you eat?
Bland, disgusting food.
Oh, okay. But I'll tell you that Tatiana I had a fish, very good fish, and watermelon.
No, I eat very bland food, very bland food.
All right. So you sound like the way you talk. No, you talk very well. But what can we do for you?
Well, this is a story. At the age of 47, as a matter of fact, my birthday's the end of this month. I'll be 62, so I guess I have to refer to geriatrics. I'm in that age group at this time. But in any event, at the age of 47, I acquired the H. pylori. Prior to that, I had never had any GI problems. I was treated for the H. pylori. Then I was scoped, and it came back negative for H. pylori. But since then, I have constant burning and belching, and I'm being treated with a proton pump inhibitor, which is Prilosec, and I also take calcium carbonate in between. I watch my diet. I am overweight, and then a year ago I went to GI doctor, and he scoped me because I had severe difficulty swallowing. I guess it's dysphagia, if I'm
Dysphagia.
not. And in any event, he scoped me and he found a polyp, so I had surgery. Thank God it was only a polyp. They removed it.
Okay,
Now, I don't
Marie,
have
I'm
that.
going to stop you here because I've got a lot of stuff here. We got a lot of good information so far. We'll talk a little bit about H. pylori and the relation to ulcers.
Yeah,
and then
but I have
polyps.
no ulcers.
Okay, we're going to talk about this. I'll ask Dr. Backash to start off, and then we'll go to Dr. Morano.
Sure.
Okay.
Well, H. pylori is Helicobacter pylori. It's an organism that grows in the stomach, and it's considered a carcinogen. It can lead to cancer if it's not treated. It also is responsible for ulcers, and most ulcers are caused by this infection. It can be treated with antibiotics and proton pump inhibitors as you were treated. And then sometimes patients, most patients over 50, about 50% of patients over 50, continue to have reflux, which is very common. The gastroesophageal sphincter, the sphincter between the esophagus and the stomach gets weak, and they reflux acid. So patients are placed on proton pump inhibitors. Unfortunately, proton pump inhibitors, drugs like Prilosec, Nexium, Acifex, Protonix, these all eliminate the acid from the stomach. And so by doing that, they increase the risk of gastrointestinal infection. So here you are in a somewhat of a conundrum. So what you're doing is you treated the H. pylori, now you're on proton pump inhibitors. Proton pump inhibitors increase your risk of gastroenteritis, of pneumonia, and also increase your risk of getting osteoporosis. So these drugs can actually create another problem, a secondary problem, and they really shouldn't be used continuously if possible. And when symptoms subside, you can switch over to an H2 blocker. So you should be scoped at intervals if you did have this and you have reflux, just to make sure you don't have a condition called Barrett's esophagus, which I'm sure the gastroenterologist has looked into and done biopsies with. So
that's good. And I think, and the polyp, find a small polyp.
It was a small polyp at the fundus of the stomach. It was benign, so I no longer had the dysphagia, but I constantly have the burning and the belching, and even though I'm taking the proton pump inhibitor, I have breakthrough burning.
Right.
So
now I'm wondering if the H. pylori had anything to do, and they said they're not impressed with my hiatus hernia. It's not that such a big problem that why I have so many problems with it.
Yeah, I think you got to modify your diet in a way and try to find out what foods bother you. Things like cheese, chocolate, carbonated beverages, anything, raw onions, certain raw fruits and vegetables.
I don't eat raw onions.
But thanks so much for the question, and we're going to call us back and we'll talk a little bit more. Before we get to the quiz question, I wanted to get to one of our email questions for Dr. Economos. And it's from Ellen from Park Slope. Ellen wants to know, she's very nervous about ovarian cancer. She's fearing that she could get ovarian cancer, and she wants to know how does she know that she gets it so she can pick it up early enough?
Well, the problem with ovarian cancer is that it is a disease that doesn't give us early symptoms. By the time a patient may have symptoms, it may be already at a point where the disease is already advanced. But there are instances where we can find it early if we pay attention to the symptoms. The symptoms classically are gastrointestinal. So the problem with that is that these patients may be seen by a doctor and taken down the wrong road diagnostically, thinking that there's a gastrointestinal problem. So problems or symptoms like bloating, not being able to eat as much food as you're normally used to eating, the feeling that you're not digesting right, aberrations or abnormalities in your bowel movements, and then additionally things like urinary problems, where you don't feel like you're emptying your bladder the right way, and the doctor determines that you don't have a urinary tract infection, yet still you have symptoms of a urinary tract infection. Things like that may be tip-offs that an ovarian cancer may be delivering.
So what should you do? Let's say that happens. What should you do?
Well, because most of the time these symptoms are not ovarian cancer, there are other problems, more common problems. The first line of defense is to see your internist or your primary care doctor. But the primary care doctor should really be astute enough to realize that if these symptoms are not explained or are alleviated within 2 to 3 weeks, that the thought should be that there may be an ovarian cancer going on. So a sonogram would be used next, and then to see a gynecologist after
Ellen,
that.
I hope that helps. And it's something that if you get in early enough, you can cure it?
Yes, if you have an early ovarian cancer, it's 90% curable.
Right. So I hope the women out there, it's good advice, and look out for those signs.
Sonograms pick up a majority of them?
They pick up the majority of advanced cancers. The question is, what do you do with an ovarian cyst when you find it early? And that needs to be investigated by the gynecologist, laparoscopy or CAT scan.
And you want to go to someone who sees a lot of these, who specializes in these.
Right.
Thanks a lot. Let's go to Gilbert on line 4. Hi, Gilbert.
Yes?
Gilbert, hi, where are you calling us from?
Pardon?
Where are you calling us from?
I'm calling from Brooklyn.
Okay, which part?
That's Gravesend section.
Gravesend, okay, and I understand you may have the answer to the question.
Well, and I know it's not jelly beans because that was no
It's not
good.
jelly beans, that's good.
And,
now, I like to set up the scene, all right? So the question was, during the Reagan administration, what products' sales increased dramatically? Now, you have the answer to that question. What do you think it is?
I think it's either the American flag or else his movies, one of the...
The American flag.
Or his movies.
No. I'm sorry, but I think they were good ideas, but we said products. I think products, so American flag might have been a product. The movies... All right, I was going to say good guess, but I don't think so.
Okay.
What's this? What can we do for you?
Well, one thing, since you're on the line, I appreciate your show very much, and it's a great show. And,
Thank you.
One thing about these viruses that are going around for flu and developing into like a stomach virus, these are very potent, and I'm wondering why they're so potent this season or this year.
It's interesting because we are seeing almost an epidemic proportion of this that starts up on the sneezing and cold and so on, ends up in the stomach with a big problem. Why are they so virulent this year? Anybody?
Often more virulent than normal. You know, these things take off.
You know,
spread from person to person. So
sometimes when you have a new virus, if it's a new virus, it hits people hard. And if they haven't been exposed to it before, they haven't built up enough of an immunity. So whenever we see something that's more powerful than the past, you think of something new, relatively new that's coming about. So that's a possibility.
It depends on your personal state of immunity. If you're run down either physically or emotionally, you might get hit harder by it. If you're not drinking enough fluids or there's some other comorbid condition that you might have. But sometimes the viruses do persist a very long time, and it seems like they go on forever. But sometimes even when the infection is gone, the inflammation stays and it lingers for a few weeks. With the flu, the cough is the last symptom that generally goes away. You know, after the malaise and the muscle pain and the headache and everything else subsides. The flu is a respiratory virus. It generally does not cause diarrhea. So gastrointestinal viruses cause diarrhea. And, you know, you could get, once the host is depressed by one infection, opportunistic infections or bugs that take the opportunity to grow on you when you're already weak, you know, might come into effect, and you might have other problems with that.
Gilbert, thanks a lot for the call. And how did they do out in Gravesend and that snow removal out there?
Well, we'll see. I think they'll be better than
I think so.
Before.
All right. Be well. Take care.
Okay.
I wanted to just solve a mystery. Last week I mentioned the place, the Brooklyn Larder. I didn't know what it was. Larder is like an old English term for a storage. It's on Flatbush and Bergen. So I walked in, finally found it open. The most gourmet items that you'd see in Manhattan, you don't have to go to Manhattan. Cheeses, chocolates, and so on. Just amazing. So Brooklyn Larder, that's what it was. I didn't know exactly what. So for those out there that are near Bergen and Flatbush, good place to stop into. Now, who are we going to go to now? Gregory. Hi, Gregory.
Hello.
Hi, Gregory. How are you tonight?
Good, good.
Which neighborhood are you calling us from?
I needed to ask a question.
Oh, wait. You have a question? You have an answer to the question?
No, I have a question about my health.
Okay, where are you calling us from? Which neighborhood?
Gravesend.
Gravesend?
Yeah, Bensonhurst.
Okay, very nice. Do you like Geno's, or what do you ever go in there?
Spumoni's. I love it there.
It's a great place. Oh, Spumoni Gardens.
There you go.
Who hasn't been? Has anybody been there? You been there, Kathy?
I haven't been there.
The Spumoni, and then on a summer to be able to sit outside in a nice summer's evening?
Yeah, it's beautiful.
Great place. So what can we do for you? What's your favorite flavor?
Oh, forget about it. Everything they have there.
Okay. So what can we do for you?
I have a very big problem. For about 4 years, I suffer from very bad headaches. And this last year and a half, they gotten so worse where I get them about 5 days out of the week. And it's so bad that it's actually taken over my life. Every day I got to take aspirins, I got to take Motrin, and no doctor can give me an answer why I'm getting these headaches.
Okay, so headaches 5 days a week. And how old are you, Tom?
35.
35.
Ooh.
Right.
Okay,
They
it's a
took
problem.
CAT
Well, we're
scans
not
and they
headache
didn't.
experts, but there's such a thing as cluster headaches that seem to grow and compound. They're usually accompanied by lagrimation or runny nose. I don't know. You should definitely see a neurologist for this.
Or you should be worked up if you don't have history of any migraines or sinus infection.
Yes.
And, if you were worked up with an imaging study, such as a CAT scan of your head, although it'd be very unlikely.
Definitely needs a neurologist.
You usually would see a neurologist. But sometimes even analgesics can cause headaches. The pills that you actually take for the headache itself can cause headaches if you're taking them on a regular basis, and they themselves can cause headache. Depression is also a cause of chronic headaches. So, it's pretty varied, and sometimes if there isn't anything identifiable, the doctors can use a trial and error kind of a treatment plan to find out what's wrong with you.
But it's definitely something that can be helped. You shouldn't be going around like this.
No. I went to numerous doctors, and they told me that, oh, well, here's what you got to take. You got to take Motrin. If that don't work, take Tylenol. And now I'm at the point where I'm getting very concerned because.
You know what I want you to do? Give me a call after the show. I'm going to give you a referral to, I think, a great pain center. Okay?
All right.
You call me after the show. We'll take care of it.
Call the same number?
Yeah, call that number, and they'll get you in touch with me.
All right.
Take care.
Good luck.
Let's go to Maureen. Hi, Maureen.
Hi.
Maureen, hi. Could you talk up? We have a little audio.
Hi, doctors. Good night. How are you?
Very nice. I detect a French accent there.
Yes, doctor.
Yes, very nice. Where are you from?
Yeah, I'm from St. Lucia in the West Indies.
Beautiful. How is that place? Beautiful, nice place to visit?
Yes, it is.
No problem with snow removal, huh?
No snow removal. Nice weather.
Where are you calling us from? Which neighborhood?
I'm in Crown Heights.
Yeah, we always lament there's no restaurant in Crown Heights. Am I right? There is no good restaurant.
No restaurants around here. Not too many, no.
Yeah, we got to do. I think there's a market there. What do you think?
So put them on up.
What can we do for you tonight?
But doctor, although I heard somebody ask you the question that I wanted to, it's a GI problem that I have.
Sure, ask it.
It's a few years now. I get it off and on, a lot of gas, like in my stomach, and I have the acid, like the burning.
Okay, so
the burning
for acid.
in my chest. Now, I'm using Pepsid.
Okay, I want you to listen to the answer because we're talking about reflux, acid going into the chest, causing dysphagia, burping, and so on.
Yes.
Yeah, and we discussed a little bit about that before. Reflux. What about the topic of reflux?
Well, reflux means that there is reflux or return of acid from the stomach into the esophagus, and you can get heartburn or an acid feeling in that area. Most gas that comes from above, if you're burping, that's usually gas that's swallowed, so carbonated beverages and swallowing air from eating fast. If it's gas from below, it's gas that's produced inside the intestines that's food-related and bacterial flora-related. So if you're burping up a lot of gas, you might be a fast eater or swallowing or drinking carbonated beverages. The workup could also be burping, and flatulence in a woman who's had babies. That could be a sign of gallbladder disease. So there's a certain simple workup that would need to be done, on a person, which might include endoscopy, looking down the esophagus, and a sonogram of the upper abdomen, and just to see what actually is going on.
Yes, doctor, I have done that. I have done that already.
And it was normal?
It's normal, yes, doctor.
Oh, that's great.
But I still get very gassy.
Gassy from above, where you're burping?
Yes, a lot. Yes.
Okay. Well,
yes.
Yeah, it might be an air swallower.
Diet, maybe the diet.
Diet could be diet also.
So you got to look for diet and other things about your lifestyle. But thank God there's no serious problem that was discovered. It's very important. So we wish you well. Good luck with the snowstorm.
Yes.
Take care. Be well. Before I get to Ray, I have another email for Dr. Economos. And the question is actually from Rachel, and she's calling from Queens. And she's asking about treatment for fibroids, that she's young, she wants to have children, yet she's been told she has this big fibroid that has to come out.
Yeah, fibroids are very common, and they can get in the way of conceiving a pregnancy. They can cause problems like pelvic pain, heavy vaginal bleeding. It can start causing problems with pressure on the bladder, on the rectum. Up until a few years ago, the classic way of dealing with this was by performing a surgery known as a myomectomy, where the gynecologist removes individual fibroids in order to reconstruct the uterus in as most anatomic way as possible. Now we have newer methods that can avoid surgery, and it's available in Dr. Garner's radiology department in New York Methodist Hospital, where we're able to block the arteries that feed the uterus to force the fibroids to shrink. So depending on your individual desires, your surgical status as a candidate for the operation, and what your general health is and what your aims are, fibroids can be taken care of either surgically or radiologically.
Thank you, thank you. So now let's see who we're going to go to. We're going to go to a quiz person, okay? And it's to never. Okay, we play like charades. Okay, what line would you say it's on? Okay, he's currently getting it up. Again, sale of what product dramatically increased during the Reagan administration? I'll give you a hint. The people calling in tonight, we could be helped by this product. We could be helped by the product. The people sitting around the table tonight.
Oh, okay.
Okay.
I think I know what that is.
Okay. So, Kathy, what is a fibroid exactly?
Fibroid is just a benign muscle tumor that grows out of the muscle layers of the uterus. So very common.
Benign. Okay, let's take a short break because Tanever got a little cold feet and hung up, so we don't have his answer. But there's a little hint that we gave you. So remember, it's something that might help the people here tonight understand the questions better. Okay? We're going to take a short break. When we come back, we're going to be talking about gynecologic oncology, rheumatology, and geriatric medicine. The number is 718-499-6101, and the email is askthedoctor@netny.net. Don't go away. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where our topics are gynecologic oncology, rheumatology, and geriatric medicine. With me, I have Dr. Catherine Economos, gynecologic oncologist and attending at New York Methodist Hospital. I have Dr. Placido Morano, a rheumatologist at New York Methodist Hospital, and Dr. Emil Bakash, an internist and geriatric medicine attending at New York Methodist Hospital. Let's get to the questions. Remember our quiz, which I'm surprised that our astute audience has not gotten. What product increased dramatically in sales during the Reagan administration? I'll give you one hint. Pablo Picasso needs only one of these. Is that?
No.
Van Gogh.
Vincent Van Gogh. Excuse me. Vincent Van Gogh. Okay. All right.
After Starry
Okay.
Night.
Now let's go to Rachel on line 2.
Very good.
Hi, Rachel. Rachel.
Oh, no, this is Judy.
Judy, hi. How are you? Were you ever called
Judy,
Rachel?
Judy.
Yeah, that's okay.
Where are you calling us
I love
from?
your show.
Which neighborhood?
Oh, Manhattan.
Which part?
I guess uptown on the west side.
Oh, very nice. Very nice. I like the Upper West Side. There's a nice flavor to it.
Yeah, it's very nice, too.
And can you mention
I like
the
it, too.
restaurants?
Yeah, Carmine's is very good on 90th and Broadway. It's
Excellent. Anybody we should ask for?
Excuse me?
Anybody we should, when we go in there to get like a little special service, what
I
do we
don't
say?
know. I didn't get to know them, but it's an excellent, and the prices are very, they're not too expensive. It's very good.
Okay, we're going to check 90th and where?
Broadway.
Okay, we're going to look for that place. Carmine, thanks a lot.
Okay.
What can we do for you?
I wanted to ask you about the question. The quiz question was it hearing aids?
Okay, wait a second. You got to play this up. You don't just, there's a style to this here. All right, so take a step back, a deep breath. Now, what's her name?
Judy.
Judy thinks she has the answer to the question. Question was, what product increased dramatically during the Reagan administration? And what is the answer?
Could it be hearing aids?
I cannot believe this. I'm so shocked. Here, Dr. Economos is getting into it. But what a great answer.
I got it?
You got it. I don't have the music that we usually have.
Thank you.
This is
I got it. I never won anything.
Judy, I want you to sit down for a second now because
Okay.
we can have some morbidity and mortality on the show. No, but what do you think about it? A plaque is going to be heading to you very shortly.
Oh, thank you so much. Thank you.
Where are you going to put this plaque?
Oh, in my living room.
Oh, this is great. It's made in Japan. I'll give you a history. It's made in Japan by hand.
Yeah.
And wait till you see this. Our quizmaster, Linda Lapatosa, puts the finishing touch on it.
Oh, wow. Thank you so much. I'm so excited.
I'm happy. I'm happy. We like to see you go find a home that somebody appreciated. So you're the
I love it. Thank you so much. Like when you guys were off for the holidays, I recorded all your shows.
Oh, wow. Thank you so much. Hope we'll get to see you sometime. I walk a lot on the Upper West Side.
You do?
Yes.
Oh, wow. Well, like where? What area?
Well, I walk down around 59th Street.
Oh, okay.
You know where the Coliseum used to be, that new place?
Yeah, the Coliseum. Yeah.
Yeah, maybe we'll see you.
Oh, okay, because Whole Foods is around there.
Right. That's why
I love Whole Foods.
Yeah, I shop a lot in there. Thanks a lot. My producer's making me move on, but stay on. They're gonna take your information for the plaque.
Okay, wait, can I ask you a question?
Sure. What's the question?
Okay, about a couple of years ago, I guess they call them the lymph nodes in the neck. Mine got swollen, and not on the collarbone, up further. And they don't have no pain or anything like that. They're like, I guess, grape size. And then 2 months later, on the right and left arm, I got swelling, and everything is still there. Is this cause for concern?
Swelling. Lymph nodes in the neck, swelling in the arm.
She had surgery to remove them? Yeah.
No, I didn't go to the doctor for it all because I thought, it'll go away and, all that stuff. But there's still the swelling in the lymph nodes.
They definitely have to look into why you had the swelling. And you might have also swelling in the axillary area, which is the armpit, and that could also lead to developing swelling in the arm. There's a lot of reasons to have swelling, so that you need to be examined, really.
Okay.
You've had mammographies, chest x-rays.
No.
You better take care of yourself. Get yourself to a doctor as soon as possible, if you don't mind.
Yeah.
Okay.
All right, be well.
Be well.
Okay, thank you.
Have a nice night. Take care. Let's go to Rachel, who's been waiting patiently. Hi, Rachel.
Hi, Dr. Garner.
Sorry it took so long to get to you.
That's quite all right.
Where are you calling? Which neighborhood?
I'm from Bensonhurst.
Oh, very nice. We got a lot of Bensonhurst callers.
I know. And the restaurant I love best is Spumoni Gardens.
Oh, the best. The best Spumoni Gardens. What's your favorite flavor, Isis?
Actually, pistachio.
Pistachio. It's a great one. I like lemon and chocolate. What do you? Anybody?
Lemon.
Lemon. It's the best. Any Italian Isis is great.
Yeah.
What can we do for you?
Okay. I have this itch since June 8th, all over my body, and I'm scratching to the point where I'm bleeding.
Right.
I went to dermatologist. They told me it was eczema, and it wasn't eczema. My doctors just said it's not eczema. I have no idea what it is. Is it possible it could be from my Coumadin? Because I'm on Coumadin because I had 2 major strokes.
Okay. She says itching all over.
Itching all over.
Since June 8th.
Does she have hives with this? Does it whale up? Do you have redness? Dryness also during the winter months. There's so many reasons to have itching all over.
Is there a rash?
There's kidney disease that can do this. There's all kinds of things.
But I didn't pick up. Was there a rash on this, Rachel?
Well, no. There were spots all over, and it started
so it
in
might
the
be
summertime.
urticaria, which is an allergic reaction to something. There's 2 types of urticaria. There's one where you could get the vasculitic urticaria, or you could get just an allergic type of urticaria.
I think the bottom line is that most likely is nothing. But to get to the bottom of it, you really need to be a detective. And sometimes you get together with your doctor. Did you use new detergent? Are you using a new perfume? Do you have a cat in the house? A new rug? A new bed?
Et cetera.
It's tricky.
No, none. And I tried everything. I mean, really everything. And it comes down to maybe
did they do a
my
biopsy?
Coumadin. They didn't do a biopsy, no.
If you have one of these red spots, they might want to do a biopsy. But you definitely need to see a good dermatologist.
Really?
Yep. Don't itch. Don't scratch anymore.
No,
I'm trying not to.
I know, but it's hard.
But anyway, what are you taking for the itching?
I've been just trying. I tried everything. everything. Eucerin. I've tried cortisone. They gave me antibiotics, medication, everything.
Did they give you Atarax?
Excuse me?
Did they give you like something like Benadryl that makes you sleepy?
Yes, they gave me that, and nothing works. No matter what they gave me, nothing works.
It's time to get a second opinion. Go to another doctor that you haven't been to get a fresh approach.
Right.
If you need help, we'll help you find one.
I also have a blood disorder called antiphospholipid antibody syndrome, and I don't know if that has anything to do with it.
Well, I mean, that's interesting you say that. That's sometimes associated with autoimmune diseases, such as lupus. So you
I was checked for lupus. I don't have it.
Uh-huh. I don't know. You have to be seen.
Yeah. You know, why don't you give us we'll get you a nice referral, okay? You need to be seen about this.
Okay. Well, I do see a doctor. I see your brother, Dr. Bruce Garner.
Well, you're going to the best. Okay.
I know I am.
What's he going to say?
I'll speak to him. Okay, I'm going to make him take care of this. All right.
Okay.
Take care. Take care.
Say hello.
Okay, we got an email question here. This is from Karen E. in Brooklyn. Okay, she's 55 years old and menopause since 50. Her health and numbers have been good. I guess cholesterol is gone. Her cholesterol has gone up. She watches her diet, takes garlic, flaxseed, omega, CoQ10. She's active on a job but doesn't exercise regularly. The doctor gave her statins. Now she's got leg pain. Statins and leg pain. What is she supposed to do? How can she avoid these medications? Is there anything else that I'm missing? Anything else that I could do? She gets this throbbing ache in her leg.
Right leg.
Right leg. Kathy, what do you think?
That's lower than
what she
I'm
did.
used to handling. I'm above the legs.
Statins can give you a problem with your muscles. You actually break down muscles, and where you'll get weakness and pain in mostly in the proximal muscles, the muscles above the knee, and also the muscles above the elbow. She's describing a muscle pain that's below the knee, and that could be associated with clots, strains, sprains, knee arthritis, can even be radiated from the hip. So she would need to be examined to see if there's localized pain and tenderness, as well as there's dysfunction of the joints.
And maybe another maybe another brand, maybe another product.
But I don't know if the statins are really causing a problem, but that needs to be investigated.
Interesting question. Thanks a lot for the question. Go to Sammy. Hey, Sammy, how are you?
Good, how are you?
Where are you calling us from?
I'm calling from Brooklyn, New York, Midwood area.
Midwood. Very nice. What's the best restaurant where you are?
The best restaurant where I am, Lotus on Coney Island Avenue between Avenue O and P.
Ed, that's a nice place. I know that.
It's a Thai restaurant. It's a new restaurant, brand new. The prices are very reasonable, and it's a good restaurant to sit down.
We have to check it out.
Right.
We'll give you a follow-up next week. What can we do for you?
Well, my question is, when I exercise, for some reason I burp. I go to a class and I do the aerobics and I can't help myself. I got to burp it out. I don't know why.
Okay, so let's hear what our panel thinks. He exercises a lot, starts burping. Is that something to worry about?
Well, I think you're burping more than likely because you're swallowing air while you're exercising. So I think your breathing pattern has to be in sync when you're exercising. I think as you continue to do so and as you train, you'll get your breathing down. So sometimes this happens to runners when they first start running. They just can't seem to be in sync. Even happens to golfers. They start breathing when they're in their backswing and they get them all out of. But that could be, you could be swallowing air, and it doesn't sound serious. I mean, unless there are other symptoms.
Keep working out, Sammy. That's the bottom line, right?
That's the bottom line.
Work out. Let's go to Rosemary, a long-time caller for us. How are you, Rosemary? Rosemary.
Oh, hello. How are you?
How are you? We missed you. We haven't heard from you.
You haven't heard from me in a while, I know.
I looked for you in Manchester.
I wasn't there.
Oh, that's why I knew. I looked all over. But Rosemary.
Yes.
So how is the snow? How is the snow where you are?
Let's not talk about it. Well, I live in Maspeth. It's all hills. You can imagine. I love my sanitation guys, but I don't know what happened.
Somebody from Maspeth came to the meet and greet at the Virgin Mary Church.
Oh, really?
He said about Three Sons. Was the restaurant Three Sons?
Yes, Three Sons.
He said he loves that place. Is it a good place?
Yes, it's very good. I love them. They're very family. It's a real family place.
But who do we ask for when we go in there?
What's the guy's name in Three Sons, Kevin? 3 sons. What's his name? What's the guy's name? Oh, he can't remember.
All right, maybe
Forget
you'll
it.
think of
We
it.
go all the time.
Are you well?
Yes, I'm pretty good. What's his name?
Okay.
Anyway, what I wanted to talk about is UTI, so she can talk about that.
UTIs.
Right.
We're getting
Now-
closer to Dr. Economos.
Yeah, I'm going to get her in the picture.
Yes.
I know that Tommaso is his name. 3 sons, Tommaso.
Tommaso, thank
Yes.
you. Thank you.
Write it down.
Now, UTI, what is a good... somebody told me about Uva ursa. Did anyone ever hear of this? It's supposedly a German herb that is supposed to help with the, urinary tract infections.
Huh.
Has anyone ever heard of this?
Upa ursa?
Yeah, Upa
Ursa is
ursa.
Latin for beer. Upa,
Beer?
maybe it's a beer upa.
Really?
I don't know.
But
Anyway,
Rosemary, it's an
I know
interesting...
cranberry juice is good for it.
You heard of it, Dr. Becker?
No,
Oh, yeah?
I didn't, but I could refer you to Sloan Kettering Memorial on their website. They have a great herbal medicine section.
Oh, good.
So if you look on the on the web search engine, Sloan Kettering Memorial Herbal Medicine.
Oh.
And then when you get there, you know, just put in whatever herb you're looking up, and they
Okay.
have all the papers and the
Great.
uses and what it is and the contraindications and
wonderful.
everything. It's very nice.
Thank you. I mean, I know about the cranberry juice. And is there any other thing that can... I don't know what you would consider a chronic UTI. That's another question I'd like to ask.
A chronic UTI is an infection that you've had more than 6 months that keeps on recurring.
It's a urine infection, for those who don't know.
A urinary
Urine
tract infection usually
Okay.
refers to a bladder infection.
Right. Okay, great.
Well, Rosemary, it's good to hear from you. I'm glad everything's well. Call back
Yes.
next week.
I will call.
Okay. We need an extra hour to this show. Look at this. We got 5 lines blinking, and we got John. Is this Joan or John? Joan?
Yes, hello.
Hey, what's the name? Is it Joan?
Joan.
Jill.
Yeah.
Okay. A very. Where are you calling us from?
Crown Heights, Brooklyn.
Crown Heights?
Yes.
Very nice. We had a caller again. No restaurant in Crown Heights, is there?
They have a few. They have some Japanese, Indian.
What's the Japanese? Do you know the Japanese one?
I don't remember the name of it, but
Or next time you call, what can we do for you?
well, I'm calling about a couple of things. I'm calling about a yeast infection thing.
Yeast infection.
Right.
I'm looking at Dr. Economos. She's taking that one?
Okay.
Yeast infection. What can we
Do
do
you have a
about it?
particular problem with a yeast infection, or?
I had the flu like over the weekend or so. I had the flu, and then I developed like a yeast infection. I used like the Monistat 1-day thing, but it's been like a whole day already. But there's still like minor itching still. How long does that take to work? And could that be from the medication? I was taking like ibuprofen, like high milligrams. Over
Are we sure it's a
500
yeast
milligrams.
infection?
That's the question, yeah.
Could that cause the yeast infection, and how long does it take to go away?
Well, any sort of flu or protracted disease, and especially if you take antibiotics for it, can alter the normal balance of the vaginal yeast and the vaginal bacteria that normally reside in the vagina. So if you disrupt that balance, one of the population of germs will overgrow another. So you can get a yeast infection from taking the medication, but if it doesn't go away with the simple over-the-counter medications, really, such as Monistat, you really should see the gynecologist to make sure that it is a yeast infection. It may be a bacterial infection, and those that needs a different medication to treat. So if it's not going away easily in 48 to 72 hours, see the gynecologist to make sure that's what it is.
Give us a call back next week. Let us know how it went, please. Let's go to Barbara, where time is what is it? Tempus future, do they say, right?
Tempus futus.
What can we do, Barbara?
Hi, how are you?
How are you today?
I'm doing well. I'm curious about, I have acid reflux disease, and I was doing well without the medication for a number of months. I was on Prilosec, and all of a sudden, again, I've relapsed. And when I bend down to tie my shoelaces, the food comes back up again. I've been tested about, I would say, 2 years ago for my esophagus, which I was concerned about, and everything seemed to be okay. I also have celiac. Does that play into it? and I also have a hiatus hernia. Does that play into it?
Oh, you got all the causes.
All the causes, yeah.
Yeah.
So I mean, it's obviously time is running short here, but I think you do have a lot of risk factors, and your lifestyle is going to be something you can control. I don't know what your eating habits are like. But, any other thoughts on this before we move
The
on?
only thing with celiac disease, I'm sorry for
Yeah, sure, go
interjecting.
ahead.
She should make sure that her vitamin D levels are good, and she's not developing osteoporosis.
I
Sometimes they have
do, and I exercise 3 days a week.
Well, you have to make sure you have to do bone densities and make sure you take calcium, vitamin D, and the vitamin D levels are adequate.
And are they
Go ahead.
anemic? Did they get anemic too?
Yeah.
I am not anemic as far as I know.
Okay, I've got to move on. I'm sorry. Call back next week, and our last caller of tonight is Mandy. Hi, Mandy.
Hi.
Mandy, you just made it in under the wire, though. What can we do for you?
Yes, I used to see Dr. Morano.
Yes?
Okay, I'm a patient of his from when he was in Coney Island Hospital.
Oh.
Very nice.
So the question is, I'd like to know, I'm on Forteo shots for about a year and a half now.
Okay.
And I'm 50 years old. I was diagnosed with osteoporosis, very severe.
Right. The Forteo is one of the best medications around for the use of osteoporosis because it's the only medication that makes bone grow. They use it for 2 years, and the reason is that that's what they were approved for. Once you finish the Forteo, you have to decide what other medication you're going to go on. Since I'm no longer there, you're going to have to either find me or find another rheumatologist.
Yeah, with that, I got to move on
Yeah, go
because
ahead.
we're running
I'm sorry.
out. The sponsors are knocking at the door. They only paid for so much. So that's it for this episode of Ask the Doctor. I want to thank Dr. Catherine Economos, Dr. Morano, and Dr. Bakash for coming in, and we hope we were able to help you. Now, it's good to remember to be proactive about your health. Speak to your doctors about your concern. Just as we said tonight, go for second or even third opinions. In the meantime, visit our website at netny.net/askthedoctor. Here you can get video blogs, the tablet column, podcasts, forums, send in your quiz, suggestions, and many more. Now, you can watch last week's episode tonight at 10 p.m. I want to thank Linda Lapatosa, the quizmaster, and I want to thank you all for your questions. Next week, we're going to be discussing geriatric medicine, chest surgery, and rheumatology. Goodbye, and I'll see you in the tablet. Have a great week.